program that many of us may or may not know much about, but it's a program that's very important to many of us because we have, most of us, known somebody, sometimes very close to our families, who need that kind of assistance and help. So Brett, come on up.
Hello, my name is Barrett Hamilton. I'm a certified drug and alcohol counselor. I'm also a certified recovery mentor and a certified quality mental health associate. So, in order to make sense of what I do, I'm just going to tell you a little bit about myself. I myself struggled with drugs and alcohol for 27 years. Went to treatment myself and have been sober since 2012, so I've been sober 9 years. I went to treatment at Best Care, where I work now. Best Care has, let me see, start in Madras. In Madras, we have an outpatient facility, we have a mental health facility, and then we also have the only Spanish-speaking residential drug program in, I think, in the state. I don't think there's another one. Then if you come to Redmond, we have another residential program. That was actually the one that I was in 2012, where you go and it's over by the dump and by Walmart. And it's a big piece of property. You go there and you live there for 30 days. You do classes every day, you do counseling, and try to learn some pro-social skills to not go back to using drugs and alcohol for coping skills. We also have an outpatient in Redmond, which is above the Black Bear Diner, and that is where you go to classes in the evening, 1 or 2 hours in the evening, you know, a couple times a week, and meet with the counselor, and it's another less restrictive way to try to get the coping skills and the awareness you need to stop doing drugs and alcohol. In Crook County, we have a big outpatient, another one like I just talked about, and mental health. And so that's another real big program. I think that we're newer there. We've only been in Prineville for the last few years, but we have a pretty big program there too, with lots of mental health and lots of addiction. In Bend, we have an outpatient facility. Same thing, you go to groups at night, you go to do counseling. And then in Klamath Falls, we have another big residential program that is for where you can stay there for up to like 90 days. So, when I first started working for Best Care 8 years ago, quite a few of those programs did not exist. So in the last 8 years, Best Care has grown quite a lot. I myself have worked at the residential program in Redmond for the last 8 years. It's because of my past, and I'm able to get through to certain kind of people that other people may not get through to. So that's, I like to look at it as, even though I wasted all those years, you know, doing drugs and drinking and going to jail and doing all that stuff, I'm able to now help people with all that knowledge of, you know, of life choices. So there's a new program that I work for now that I just started the last few months, or I think it's been a month. And this one is the main director of Best Care, the CEO. This is like his little project. And so now we have people from Best Care stationed in Prineville Hospital, Madras Hospital, Redmond Hospital, and Bend Hospital. And so now I'm on that team. It's called the Community Engagement Team. And basically what that is we go into the emergency room every day or into the hospital floors, and anyone that is in there for any kind of drug or alcohol related stuff, pancreatitis, liver problems, overdoses, anything that comes along with drugs and alcohol, myself and the person I work with will go into their room and talk to them. And the people that are in the hospital, they're, for the most part, a lot worse off than the people that I've been working with in residential treatment, because those people, made a decision to go to treatment, and they, are trying to make some different choices in their life. The people that are in the hospital, a lot of them have no desire to stop. They have no desire to do anything other than what they've been doing. A lot of them don't even think it's a problem, and when you see a 25, 27-year-old young person who has stage 4, cirrhosis and is going to die, and you're telling them, hey, do you want to do something different? They're all, nah, my drinking's not that bad, and it's like, your body is telling me something different. So the program I'm in now is we go in there and we try to just build relationships with some of those people. Some of the people in the hospital will want help right away. They're like, yeah, I need treatment, and my job will be to get them into treatment. My job will be to get them to primary care, their PCP appointments, get them to mental health appointments. There's a big majority of people that use the emergency room, a big majority of alcoholics and drug addicts, they use their emergency room like their own private doctors. And so anytime they have any problem, whether it be a hurt toe or liver failure, they go into the emergency room. And that's a very expensive route to go rather than going to your doctor, And so my job is to try to assist them in stop utilizing the emergency room so much. Especially in times like right now, when the emergency room is full of people with COVID, and there's no room for them because there's a bunch of people in there that could possibly be going to their doctor for this, or could possibly wouldn't go as much if they had some mental health counseling. And so there's all these different reasons that we're trying to limit their going to the emergency room. So it's saving taxpayers money, and it's taking some of the pressure off the hospital, which is definitely needed right now. So there's a third of the people I meet in the hospital will agree to do some help, and get some help. A third of them will tell me they don't really need any help, but we're willing to meet up with me after they leave the hospital. Maybe for coffee, maybe they live in the homeless camp and I'll bring them out ice, or I'll go pick them up to take them to a doctor's appointment, or I will slowly try to build this relationship with them so that they trust me. And then maybe throughout time, they will agree to do something different. And then unfortunately, the last third are just going to keep doing that until they die. And my job again is to kind of walk through that with them. And it's kind of, I think I was telling him, it's like standing with somebody that's drowning and you're just holding a life vest. Oh, do you want this? And they just say, no, I'm fine. So a third of them are probably going to die. And I'm just there in case at any point they decide they want to do something different. The majority of people that, that are in active addiction compared to the people, the number of people that will actually go to treatment is very low. There's a lot more people that are not willing to go to treatment than are. And so my job is to just slowly try to get them to do something different. And a lot of times it's harm reduction. Like, can I, make you a doctor's appointment? Can I have you go to, we have a medical detox. We're the only place that has medical alcohol and drug detox in Central Oregon. So if you're detoxing from alcohol, you can't do that by yourself. Like, you could die. If you just stop drinking, if you drink every day and you just stop, you could potentially, it can kill you. And so instead of going to the emergency room, maybe they call me and I can get them a bed in our detox. Once again, it's a lot nicer place to be than the hospital. And it's a lot more cost effective for the taxpayers. So, I'm working with different a different group of people. I'm working with a different group of people than I have the last 8 years, but then at the same time, there's a majority of these people that I already know because they came to treatment and tried it. So, Redmond's a small place, and so I can go to the hospital and maybe someone's being combative, is under the influence or something, and they'll say, hey, can you go in there and talk to him? And then the minute I go in there, their attitude changes because they already know me because they've been in treatment before or they met me before at the hospital. So it's an exciting job. I've loved what I've done in the last 8 years with Best Care, but this is something new and completely different than what I'm used to, and it's good. It's good because like you said, almost everyone, probably everyone in this room knows someone that's affected with addiction. Drugs or alcohol are definitely affect everyone. It's a family disease. If you have someone that you love that's destroying their life with drugs and alcohol, it affects you. It's not like they're just, only hurting themselves. That's not how it works. It's a family disease because it affects everyone that cares about you. And so, my hopes are that I can get as many people to try something different instead of going to the same thing over and over and over and over again. So I'm also out in the community, maybe people that aren't even in the hospital. I go to the homeless camps and ask people if they're interested in getting tested for HIV or hepatitis C, because that runs rapid too in the drug world. And so I can get them, I can take them to a place to get tested, and then if they are positive for it, I can help them get treatment. So not everything I do is in the emergency room. There is part of it where I'm out in the community trying to, sometimes it's easy as just, going out to the homeless camps and bringing ice and just, hey, you need a bag of ice? Oh, sure. And then that gives me a chance to talk to them and say, hey, have you ever been, you ever thought about getting tested for hepatitis C? Do you have a doctor that you go to regularly? Try to catch them before they make it to emergency room, And so our program is a lot smaller. The one in Bend, for St. Charles in Bend, is a lot bigger. Obviously, it's a lot bigger hospital. Ours is a smaller version of that. And so, that's pretty much what I do and
Could you tell us something about the spectrum of where people come from? You talked about being in the homeless camp. Is that where we find most of your clientele?
No, they come. Alcohol, drugs does not discriminate against anyone. You could be living on Aubrey Butte or you can be living under a tarp. It doesn't matter. It affects everyone, and you take all different classes of people, everyone. At the residential program, we'd have someone that's a pharmacist in there sitting next to a person, and sharing a room with the dude that's a heroin addict that lives in a homeless camp. It's everything from people with doctorates to people with junior high educations. The drugs and alcohol don't care.
So Carl and I were talking about getting a doctor's appointment. You call them up, it's 2 months. So you're not going to go, you're going to go to the emergency room if you have whatever, because you get in today. My question though is, so you say these people you see in the hospital, they're basically in denial. What's the next stage after that? And is it a stage you can help them with, or what?
Some of them, it's kind of like you're just building this relationship, and then the next time, oh, no, I'm fine. Like, okay. And then, I have access to that medical record. In the morning, I go to my office, and I look it up, and it goes, okay, this person, I get a little email, he's back. And so I'll go down there and say, hey, remember me from, last week? Oh, yeah, I talked to you. How's it going? What brought you in here? Oh, I was just, dehydrated. All right, well, last week you had a different problem, but so you think it's, anything to do with alcohol? No. Okay. Well, here's my card again. Let me know if there's anything I can do for you. You don't want to necessarily say you need to get sober, because that will make people not talk to you. Some people that are in denial are not you're gonna make them mad if you do that. So I just kind of keep showing up until eventually they go, oh, you're back again. I'm gonna be here every time you are. And they, and hopefully the idea is they will start to trust me and then say, yeah, maybe I should try something different, you know. And then I'm there. I'm like, once again, I'm there with this life vest. Like, do you want this? No, okay, I'll have it when you want it. And just keep showing up. Like I said, in other places, I've been doing this hospital thing for a while. I'm new to this position, so I'm just learning the ins and outs on how to navigate different people. But like I said, I've been doing this. One thing, I've been around alcoholics and drug addicts my whole life. Like growing up, my family, myself, everyone I knew, I didn't know anyone who didn't do drugs. So I can function well in people in that lifestyle, you know. And I also know the other side of it now, what it takes to get your life back together and what you need to do. And so I can relate to them, and then they can usually relate to me because I get it. You know, I understand what they're going through. You know.
Who pays for these treatments? Do the individuals have insurance that covers it, or do you get assistance from the government? Or
my service, what I do, I'm paid for by Best Care, but it's through a grant, a federal grant. That's what pays me to do what I'm doing. And then Oregon Health Plan is usually, you know, the hospital will get you set up with Oregon Health Plan if you don't have insurance. You know, everyone gets insurance. So that, and then if you have private insurance, then that they would pay for it. But usually, you know, usually it's the Oregon Health Plan. Once again, that's taxpayers, so we're trying to limit that utilization so much.
Other questions?
Yes,
Yeah,
lots of them, lots of them. How do we, I mean, if we only find these individuals that are in the hospital, at what level are they in the hospital? You know, I'm not naive about this, but I wanted to know how you really assess the individual. Are they in chronic condition and passed out? Is that what happened, what brought them to the hospital, or?
You know, it's the whole gamut. A lot of times, like pancreatitis, I see a lot of that, you know, which is caused by drinking, or it can be flared up by drinking. It can also be flared up, I think, by diet, but most of the time, so I look in the file and I see, oh, this person was intoxicated, or this person, a lot of times I can see that person's been there 7 times in 4 months. I go, okay, this is someone I should talk to. If you're just there once, maybe it's not a big deal, but if you've been there 7 times in 2 months, you're probably someone I should talk to. You know, and so it's everything from, you know, someone fell down drunk, you know, to someone that's obviously not going to live long. Like, you can just tell by the color of their skin and their pigment that they're like, you know, they're gray, you know, and they are having liver failure, and they just keep coming in. They get them, you know, the emergency room is supposed to just get you better and get you out. Like they, you know, for the next person. So they're just, it's a revolving door that hopefully I can intervene in and say, well, let's try to do something different with your, you know, medical stuff. It's not, I don't always have to approach the drugs or alcohol. I can approach like, hey, let's go see if we can get you into a normal doctor and try to get you set up. You know, a lot of people don't know how to even navigate any of that. And so that's where, okay, let's sit down and let's call, you know, Mosaic Medical and see if we can't get you an appointment in there. And sometimes it is, you know, a while out. But sometimes because where I work, and sometimes we can get people in there, you know, like, you know, on a cancellation list, or like, you know, there's other ways. And then we have medical doctors too that work for Best Care. We have a medical director.
And how do you interface with AA and other groups that are?
Personally, that's what saved my life, is Alcoholics Anonymous. So I go to AA, you know, I go to a men's group once a week. Different people have different opinions of that. Sometimes it's one of those hot topics that you can make someone immediately not want to talk to you anymore. So I'm careful on approaching that. I usually ask them, so what have you done before this? You know, have you ever gotten any sober time before? They're like, yeah, you know, I went to AA for a little bit. Well, how was that? You know, I hated it. I'll never go back. It's a cult. And I'll say, okay, you know, I go, so I know don't bring it up to them. I don't tell them that's where I go. You know, but they go, that wasn't bad. I say, hey, I go to AA. You want to go to? I have a good men's meeting. I go to. Would you like to go with me? You know, and then there's other ones. There's Celebrate Recovery, which is more Christian based. You know, and some people like that, and some people are totally against it. And then there's one called Refuge Recovery in Bend, and that's like a Buddhist base. It's more like meditating. And so there's, obviously I believe, for me, I believe in abstinence base, which means I can't do anything. I can't drink, can't smoke marijuana, can't take a pill, I can't, that's what works for me, is not doing anything. But sometimes you have to meet them where they're at. And by that means like, well, I want to quit drinking, but I don't want to quit smoking marijuana. All right, well, let's try that. Let's see what we can do. So how can we not drink and continue to smoke? And then usually, after they try that, they realize, I went back to drinking because I was smoking marijuana. All right, well, maybe we should not smoke the marijuana. Or maybe, some people can. It's about harm reduction. What's going to kill you? What's going to less likely to kill you? Sometimes that's a little bit harder for me because I believe you shouldn't do anything. And for the kind of drug addict and alcoholic I was, I can't put any substance that doesn't belong there in my body. Because I tried it. I tried just smoking marijuana and it didn't work. And I tried just doing this and doing that stuff. And so I have to make sure I don't push my agenda on them. Like, well, you can't do anything or else you're going to fail. Oh, what do you want to do? I put it in their court. What would you like to do? And I may think it's not going to work, but I'll do it with them anyway, so they can find out themselves it's not going to work.
Suppose you have someone who wants to stop. What kind of facilities do you supply?
Oh, yeah, I can get them into residence treatment if they're willing to go live somewhere for 30 days and get, completely clear-headed. All the way up to Klamath Falls, where you can be there for 90 days. Or we can get you an outpatient where, it's not so restricted. You can still work. You can still live at your house, and you just go a couple times a week and go to some groups. We want to try to get you clean and sober in the less restrictive environment as possible. So you don't necessarily just want to jump right to residential, because you'll go there and then people are all, oh, this is way more intense than I thought. Let's try it in outpatient, and then if that doesn't work, you go to the next, it's called levels of care. So we have all kinds of different, you can go to outpatient once a week, or you can go 5 days a week. You can live there 24 hours a day, or you can, whatever we can get you to agree to.
How does a family member help them?
Fortunately, they have to want to do it. They have to want, you can be there to be supportive, but if they don't want to do it, they're not going to do it. And that's the hard part for family members, because you want to help, and if they're not willing to do it, then they're just not going to do it. So you can just keep offering, hey, do you want to do this? Do you want to do that? And be there ready to support them. And the biggest thing I would say is don't, and this is really hard, don't enable them. Don't, people, this is something they say in AA, you can't hit your bottom if someone keeps catching you right before. And that's really hard for a family member, because your loved one, your kid, your child, your brother, your sister, and you're seeing them suffering. And so you want to help, but sometimes that help is not allowing them to get to the bottom where they do it themselves. So it's easier said than done. Like, it's easy for me to say that, but if you're in the middle of it, it's very, I was told by my family for years, you should get help, and I just was like, oh no, I'm fine. Until finally I made that choice for myself. I made it for my daughter. I didn't want to be like my dad, so I finally said, this is my chance. I went to residential, it gave me 30 days clear-headed, and I'm all, okay, I can live, I can do something different. And so, but believe me, for years my family tried to, come on, go to treatment, do this, and I just was, no. I wish there was a better or easier answer for you with that.
Are there any tips that do work? Like a brochure on the table, or
Sure, catch them at the right time. You know what I mean? Like when they're usually when they don't have the drugs or the alcohol, and they're upset. That might be a time like, hey, let's. You don't want to do it when they're super drunk or high on drugs, because they're not going to listen. But if you can catch them at those certain times where they're you can tell that they even don't want to do this anymore. You know, they're coming to you like, I need help. Okay, that's when you try to act, you know, or catch them at those times where they're open to hear it, you know, and those times could be far and few between, or it could be all the time. You know, it really depends on what substance they're using and how far down they went with it, you know. But you want to try to catch them when they're not intoxicated, because it's like talking to a brick wall. I mean, they're not going to listen to you.
Is it true that, okay, you're an alcoholic on beer, you can't just quit because you have problems? I mean, do you have to taper off, or do you?
Alcohol is the only one that, the only thing that can, other than like, yeah, alcohol is pretty much the only one that can kill you. So if you drink, a heavy drinker, and then they stop drinking, it can make you have seizures and it can kill you. So if you're a heavy drinker, you would want to go to a medical detox. A lot of people end up in the emergency room because of that, because they, okay, I'm going to cut down on drinking, and then they get a day into it, you know, you start hallucinating, you have a seizure, so that can be really dangerous. You know, people think of, you know, heroin is you know, detoxing from heroin won't kill you, it's just really unpleasant. You know, it's a really unpleasant feeling, but it's not, you're not going to die. You may feel like you're going to die, but you're not. Detoxing from alcohol absolutely can kill you. You know, so, you know, we even tell people like that have a detox bed, you know, they're in the hospital, we can get you a detox bed in 2 days. Okay, should I quit drinking now? You know, probably not. You might as well want to keep going for the next 2 days, because if not, you're not going to make it in 2 days. You know, it's alcohol is, you know, people misjudge. They don't realize how deadly it is for you, because it's acceptable. And, you know, some people can drink and be fine and have a drink with dinner or at the Super Bowl and they're fine. And then some people cannot do that, you know. But yeah, I would never suggest someone just stop drinking without some kind of medical attention. If you drink 1 or 2 beers a day, sure, you're fine. But if you're drinking a fifth of whiskey a night, you know, and then all of a sudden you can't get that whiskey, you're gonna have a problem. That's what happens at the homeless camp. Sometimes they get so sick out there they can't even go get the alcohol, and then that's how a lot of times the ambulance has to come. You know, someone finds them, or sometimes they pass away.
Well, I want to thank you for what you do. I used to work at the county, and these frequent flyers take up a majority of the budgets that we put into healthcare.
Yes.
And the program I hear you say is really probably the best way to address and treat these people. And I'm hoping you got a good team behind you, and thank Rick a whole bunch for making this a priority.
For sure.
Yeah, just thank you. To me, this is the best approach that we can have to try to address this.
Rick's an amazing person for sure, and yeah, this is his baby. Like this is super important to him, and so I'm actually feel privileged that he allowed me to do this. You know.
You may have already said, are your residential treatment programs both for female and males?
Yes, they're both. The one in Klamath Falls, there's males and females there, but they try to segregate them. It's like an old, I think like some kind of old hospital, the building. So there's like a wing and a wing, so they can keep them separated. The one in Redmond, they're mixed together, and so you can imagine that's a whole nother problem. But yeah, so one is separated and one's not. So
good. Thank you very much for coming and presenting a program to us. We appreciate it.